Myself, Dr. A.M. Karthigesan, Senior Consultant Cardiologist and Electrophysiologist, Apollo Main Hospital, Chennai. Pacemakers are commonly implanted for the low heart rate patients. Nowadays, we have two types of pacemakers. The conventional pacemaker, which are available for many decades, which are implanted from the left shoulder region, and then the leads are placed inside the heart, and the machine is placed under the skin in the left shoulder region below the collarbone. Recently, we have last few years, we have started using another type of pacemaker called leadless pacemaker. The advantage of leadless pacemaker is there is no cutting, suturing or anything. So we can deploy the pacemaker inside the heart from the groin itself, from the small puncture. So it's like a keyhole procedure. We can take the pacemaker, which is small miniaturized size like a small pen drive. We'll take into the heart through the sheath and deploy it, and then we'll check the parameters and then apply the bandage in the groin region. That can be removed very next day. The patient can walk away. Today, this patient, now we are accessing the groin. After draping the groin with ultrasound gated puncture has been done, we are inserting the wire inside the right atrium and advancing the big sheath and keeping it in the right atrium. Then we prepare the leadless pacemaker, which is a long sheath, which is inbuilt pacemaker has been loaded in an inbuilt sheath. After flushing it, we load inside the big sheath and go get into the right atrium, and then by deflating it, we can get into the right ventricle, where the conventionally regular pacemakers are placed in the right ventricle. So we find out the ideal location, either in the apex or in the septal region, and slowly deploy it, and then check the parameters like any other conventional pacemakers. Parameters are checked. Once we check the parameters from the outside, what is called PSA, we can, even though the pacemaker has been deployed inside, can be communicated from the outside device, which is called analyzer. So we get the data from the pacemaker, whether the parameters, the pacing, sensing parameters are okay. We find out if the parameters are fine, then we can cut that thread and release the pacemaker inside the heart and remove the sheath and suture the groin. And then that is a very minor suture that can be removed very next day. So patient can be mobilized after 6 hours, and then patient can sit and then can walk, and then so patient can get discharged on either the same day or the very next day morning. Now the advent of AV synchronous pacemaker, that is AV micra, so that has been deployed in the right ventricle region in this patient, where this patient is getting intermittent complete heart block, where the atrial activity is normal. So this can be deployed in the right ventricle. So it is stimulate the right ventricle in synchronous with the atrial activity. So it tries to mimic like a conventional pacemaker. So this is reasonably okay for the patients who have very limited activity due to multiple comorbidity, and then so where their risk of regular pacemaker is too high in view of multiple comorbidity. This is the excellent pacemaker. Can be done very quickly and then without much sufferings, and patient can be very quickly discharged also from the hospital. So that is the advantage of this leadless pacemaker. Thank you.